So I'm almost in a sense redoing a story from January of this year, which is that Kamala Harris is again being accused of flip-flopping and backing away from Medicare for all, but this time I actually don't think she is. I think there is a flip-flop here, but it's a different one from the one that most people are talking about. So let me set this up for you. We need to be really clear about the terrible way in which the healthcare questions were asked to the Democratic primary candidates in night one and night two of the debate. The main problem is the way that those questions were framed was bound to lead to confusion, and I wish that candidates had actually called out the framing of those questions, but I'll back up and we'll get to that. Back in January, Kamala Harris did a CNN town hall, and during the CNN town hall, she was asked about Medicare for all, and here's what she had to say.
What is your solution to ensure that people have access to quality health care at an affordable price? And does that solution involve cutting insurance companies as we know them out of the equation?
I believe the solution, and I'm actually feel very strongly about this, is that we need to have Medicare for all. That's just the bottom line.
So that was very definitive. But then the day after that, she backed off. An advisor of hers put out a statement saying, well, she's open to more moderate ideas as well, like preserving the industry we have and making tweaks to Obamacare. And it appeared to be a significant backing off from Medicare for all. So then the debate happens late last week. And the day after, Kamala Harris is interviewed. And once again, the accusations start flying that Kamala Harris is flip-flopping, that during the debate, she raised her hand and said, I'm for Medicare for all, and that the day after the debate, she backed off of that and said, I'm not actually for Medicare for all. There is a flip-flop here, but it is not the one that is being reported. Kamala Harris said she was for Medicare for all in the town hall in January. The next day, she did sort of back off of it. And now she is again saying that she's for Medicare for all. The confusion is, again, how that question was asked. So let's now look, and this is mostly visual. This is when the candidates were asked, raise your hand on health care, but listen to how the question was framed.
Who here would abolish their private health insurance in favor of a government-run plan? Yeah. All right.
So Kamala Harris raises her hand there, and as I said at the time, this was a terrible, terrible question. This led to confusion. This led to people being able to just cop out, claim they didn't understand it, whatever. And case in point, Kamala Harris was interviewed on CBS the day after the debate, and she said, oh yeah, I raised my hand, but the question was, would I give up my private insurance for a government plan? Not, would I want private insurance abolished? And then she gets into an argument with the interviewer. The interviewer says, no, the question was, should private insurance be made illegal? And I called this question out because it was improperly asked for exactly this reason. And then Kamala Harris gives us, I guess, what you would call her real position on this issue at this point in time.
Senator, another defining moment in the debate was when every candidate was asked to raise their hand if they would abolish private insurance. In that moment, you raised your hand. But afterwards, your campaign says, actually, that's not your position. So what is your position on private insurance?
So the question was, would you be willing to give up your private insurance?
That's not how it was asked.
For such a plan. And
that's what you heard, right?
Okay. Yeah, that's certainly what I heard. And in terms of, I am supportive of Medicare for all, and under a Medicare for all policy, private insurance would certainly exist and for supplemental coverage. But under Medicare for all, and my vision of it, we would actually extend benefits. So, for example, vision care, dental care, hearing aids, which currently are not covered, and anyone you know who's a senior can tell you they're extremely expensive and people have to come out of pocket to pay for them. Included in my perspective on the issue of private insurance is this, and I told the story last night. Look, any night in America, there is some parent who's got a child who has a fever that's out of control and going to the emergency room to get help at the middle of the night, and then looking at those sliding glass doors as they're in their car in the parking lot, concerned that if they walk through those sliding glass doors, they're going to be out of pocket $5,000 because of the deductible. They've got insurance.
All right,
but they will be
Senator
out of pocket $5,000.
We're going to have to leave it there.
So, 91%, and I'll just add 91% of the doctors in America today are in Medicare. So you won't lose your doctor.
So I don't actually see this as a flip-flop from the debate in the way that I understood the question, but the whole point is the question was terribly asked. what did they actually mean by the question? Were they saying, would you personally, given the option of giving up your private insurance for a government plan, opt for that plan? That was a reasonable way to understand the question. Others understood it to be this sort of right-wing meme talking point of Democrats would make private insurance illegal if such a government plan was put forward. And the question, by virtue of being a terrible question and improperly asked, led to exactly this type of thing. So I don't see the flip-flop that some people are claiming. I don't see that Kamala raising her hand means yes to Medicare for all, and then in the interview she said she's against it. My interpretation of the Kamala flip-flop is that in the town hall, she said, I'm for Medicare for all, and got the political benefit of that. The next day, a statement was put out in January saying, well, she's open to other options as well, but she likes Medicare for all. And now apparently putting her finger to the wind and recognizing that this is not a good path forward if she is not for Medicare for all. Look at how Joe Biden is suffering as a result of his position on healthcare. She now again is saying, oh yeah, I am just for Medicare for all. So bottom line, it does seem that Kamala Harris is on the Medicare for all train right now, but remember, she can very easily pay lip service to it and say, I'm in favor of it, without having any real plan or goal of implementing it if she were to become president of the United States. We need clarity from our elected officials, from the candidates in particular, about what their policy is. And you have to understand, someone saying, I'm for Medicare for all, if you don't follow that up and say, okay, if instead what was proposed were simply some tweaks to Obamacare, would that be okay with you? Unless you ask that follow-up, it's very easy to say, I'm for Medicare for all, and I'm for the public option, and I'm for tweaking Obamacare, and I'm for also not really making too many changes other than maybe expanding access to Medicaid. You've got to go further, and this is why the debate question fell so flat, where now we're arguing about which is the flop, if there is one, that Kamala Harris made, rather than a better asked question during the debate would have given us much more valuable information about what these candidates actually stand for. If you love learning new things, you probably want to check this out. The David Pakman Show today is sponsored by Skillshare, and we're giving you 2 entire months of free access to Skillshare when you click the link underneath this video. Skillshare is a vibrant online learning community offering more than 25,000 video classes on just about anything you can think of. Get better at playing an instrument. Learn to use Photoshop. How to edit videos. They have classes on drawing, painting, business, cooking, nutrition, personal productivity, and I'm not even really scratching the surface. I recently took a great class on introductory watercolor painting. I'm still not good, but I am learning, and you can access the entire library of fun, easy-to-use online courses for free for 2 months by using the link underneath this video. 2 months of learning something that's totally new to you, something you want to get better at, something you already love, or you can get ahead in your career by learning new skills that will help you at your job. I've gotten a ton out of it. Pat has taken some courses that he's found really valuable, and I think you'll love it too. Get started for free by clicking the link under this video.